we don't know is the honest answer. Like many things during the COVID pandemic, we don't really have robust evidence to guide us. But certainly the current guidance is that if you have COVID, that we should defer the vaccination until 4 weeks from the COVID, from the positive swab or from the start of COVID symptoms once the infection is confirmed. And therefore, in answer to this question, my answer would be is that to defer the second dose of the vaccination until 4 weeks from COVID. I mean, just to maybe talk about the current guidance in the UK, that we have interval of 8 weeks between the 2 doses of the COVID vaccination, but that can vary among the countries. We just launched last month the country's largest clinical trial that would be able to help us answer what is the best dosing interval of the COVID vaccination. But certainly this question, you would say defer the second dose of vaccination until 4 weeks from COVID. An important point just to bring to the discussion is the reactogenicity. That means the symptoms after the vaccination. So we know that if you had COVID, you're more likely to get more severe symptoms after getting the vaccine. And just to put things in perspective, it's not severe that potentially could harm the mother or the baby. But certainly, so number one, you're more likely to get severe symptoms if you had COVID, and you're more likely to get severe symptoms after the second dose of the vaccine. And therefore, if this woman is near the end of the pregnancy and you worry about the potential consequences of severe symptoms, particularly fever after giving the second dose of the vaccine, I think it's also reasonable to defer it until she has a baby. But certainly if it's in the first half of the pregnancy and you want to give the full protection of the vaccine, I think just defer it 4 weeks from getting COVID.
Well, thank you again for the question. I think this is a very important occasion to state firmly that there is no evidence concerning the evidence on the long-term adverse events for the mother, for the baby, and for the pregnancy itself related to the administration of the COVID vaccine during pregnancy. So on this basis, the recommendations for all the pregnant women are to get their vaccine while pregnant at any trimester, ideally prior to the 3rd trimester, because it has been proven to carry benefits for the pregnancy itself. So that's for sure my answer to the question.
It is worth noting in this context that long-term effects of vaccines are exceedingly unusual if we look at vaccines in general. So the adverse effects are usually, if there are any, would be picked up relatively quickly. Asma's nodding her head, so I assume do you have anything to add on that response, Asma?
Well, I think in terms of the safety of the vaccine, I think we should reassure pregnant women that I don't think we have any concern that the vaccine can harm the mother or the baby. There are studies which are collecting data. I think talking to pregnant women, I think it's often they have no concern about themselves. The main concern is about the baby and the development of the baby. And just back again to the trial that I mentioned earlier, the PrEP-COV trial that we launched in the UK, we are following up these babies until the age of 1 year. So hopefully we'll have even better quality data.
That certainly sounds like a trial that needs to be done. So good luck with that.